One in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime. That's according to the CDC. Most women will have to go through some type of surgery as part of their treatment. Dr. Sai Kiran and also Christina Bisuito are here to explain some of the advancements in this procedure. Thank you both so much for being with us this afternoon.
Thanks
we
for
appreciate
having
it.
us. Thank you.
I want to start with, what are some types of surgery to remove breast cancer?
Yeah. So a breast surgical oncologist like myself would be the person that would be removing the breast cancer. And there are two main types of surgery you can have. You can have a lumpectomy, where we only remove that area that has the cancer in it, and you leave the majority of your breast tissue behind. Or you can have a mastectomy, where we essentially remove all of the breast tissue.
What are some of the complications that come with either one of those procedures?
So luckily, since the breast tissue is right underneath the skin, this is mainly just very small amount of complications in terms of some bleeding or infection.
Okay. Being in your line of work, can you kind of speak to, it was a pretty staggering statistic from the CDC. What is it like for you personally to work with these women when they are probably most likely at the most difficult point in their lives?
So it is a really devastating time for women, and they come in and they're usually overwhelmed with emotions and questions, and their heads are usually spinning. So it does, we both spend a lot of time with patients and really explaining things. And I always like people to bring a support person with them, because it's really hard to process all the information that you're given. It's a lot of information. And I always offer for them to come back in as many times as they want, in order to make sure that their questions are answered, they understand everything that they're going through.
You talked about the two main surgeries. What is recovery like for those? I imagine with the mastectomy, it's a little bit more involved.
Right. So in terms of lumpectomies, those are usually outpatient procedures and shorter recovery times. In terms of a mastectomy, I think a lot of it depends also on whether or not the patient has reconstruction. And then that kind of dictates in terms of how long the recovery would be. So.
And I usually say 6 weeks to be safe in terms of activity restrictions.
How far do you think we've come? What are the advancements in surgery itself, the technology, the techniques?
Oh yeah, so that's the one exciting part about breast cancer surgery, is that we're constantly trying to improve upon our techniques. We now know that breast cancer, majority of the time, is more like a chronic illness than really any sort of defining characteristic. So women are living a lot longer after their diagnosis, and then that's made us take kind of a step back in evaluating how we're going through these types of surgeries. So we've started combining a lot of our oncologic or cancer removing surgeries with plastic surgery to try to minimize kind of the cosmetic defects or complications after this procedure, and keep the patient as whole as possible. So a part of my training has been the oncoplastic breast surgery, where we combine some of those techniques with the lumpectomy, but I work very closely with Dr. Bisuito even in lumpectomies, in terms of what we can do for reconstruction after lumpectomies as well as mastectomies.
You touched on something, I think is sometimes considered a little taboo to talk about, but if you're faced with a cancer battle and you're going through this and you come out on the other side, I think some women maybe sometimes feel shame sharing that they do want to look whole again, that they do want to explore plastic surgery options. Can you talk about that component? You can come out on the other side physically, but also emotionally with your confidence.
Absolutely. I mean, this isn't a cosmetic procedure. This is a reconstruction. This is something to make you feel whole and functional again. And there is research to say that women emotionally, mentally, physically do better with a breast reconstruction, and they feel better after. And there should be no shame or taboo, about it, because it's something that helps define us as women.
What about health insurance? The last thing you want to do is be worried about finances. What help is out there, and what's typically covered, not covered?
So the breast cancer reconstruction is something that is covered by insurance. Pretty much all of the procedures that we do fall under that umbrella of post-mastectomy breast reconstruction, that insurance typically do cover that.
Okay, wonderful. In your professional experience, how satisfied are women after this process? Because like we said, you're meeting them at their most challenging time. When they do come full circle, what is that like, those interactions?
So this is my favorite part of choosing this specialty, because this is the type of surgery where we get to develop relationships with our patients and long-term relationships. So even after the surgery portion is finished, we still continue to follow these patients, sometimes as long as they'll have us. So there's no real discharge date. And it starts off by being a very uncomfortable, anxious time where they're very kind of fixated on the diagnosis and the treatment. And then it turns into social visits, and we get to learn about their kids and trips that they've taken, and you really get to feel one with the patients as they relax and they realize that we've come on the other side of this, and it's something in their past that they are not really thinking about until they come to their next follow-up visit.
Well, that certainly says a lot about the care the two of you provide. Thank you so much for being with us.
Thank you.
Appreciate it.